welcome everyone. I think some people have come through into the lobby, some people still in the lobby, but I think you should all be trickling through now. So welcome to this seminar on family drug and alcohol courts and the rollout of them across the country and our latest report. I'm Phil Bowen, I'm the Director of the Centre for Justice Innovation. I'm delighted to welcome you all to this seminar. Just in terms of some housekeeping from me, so we are recording this event on Teams, so a recording of it will be available shortly after, well, I might say shortly after, once we've uploaded it to our website, so in the next couple of days. We are asking you all to mute yourselves with cameras off for the course of the presentation. And then when we get to the Q&A part of the session, we'll ask people to raise their hands, turn their cameras and unmute themselves to ask their question. But I'll go through all of that when we get to the Q&A section. The first part of the session will be me and my colleague John Newman, who works for Untitled, giving the highlights of our new report, Fdac, Family Drug and Alcohol Courts, the business case for rollout. That's our new report, which will be going live on our website as of 9 AM tomorrow. But we're giving you a kind of sneak preview of that report this afternoon. So I'll present that report with, as I said, my colleague John Newman from Untitled, who's helped us write that report. And then there'll be a Q&A session with a panel, which will include me and John and Vicky Morris, Deputy Director at the Centre for Justice Innovation, who leads up our operational work on Fdac. Just a couple of words from me about the Centre for Justice Innovation and our role in Fdac. So the Centre for Justice Innovation is a not-for-profit that's been going for about 10 years. We work obviously in and around the justice systems, both criminal justice and family justice. And as of 2019, took over a role previously performed by the Family Drug and Alcohol Court National Unit. We took over that role in April 2019 to provide support to existing family drug and alcohol courts and to lobby for their increased role within the family justice system. So this report is part of that long commitment we've had to family drug and alcohol courts, and I'm looking forward to taking you through it. So now comes the slightly nervous part of this presentation, where I try to make sure that you can all see my PowerPoint slides. So give me 2 seconds and I shall get them up. Hopefully I can take you through this sort of overview of the business case. So as I said, this is really about our report coming out tomorrow, which is the business case for the rollout of family drug and alcohol courts. So just to give you a bit of the background to the business case, I'm sure many of you on this call are aware, but parental substance misuse is obviously a huge issue when it comes to children's services. So due to the neglect and abuse that stem from parental substance misuse, we know that often those families are in contact with children's services, and at the highest level of concern, obviously local authorities can initiate care proceedings to remove a child from their parent. Therefore, it's not surprising that care proceedings are one of the most serious interventions the state can take in a family's life. A negative outcome can mean a family loses their rights over and access to a child forever. So the stakes are enormously high. And as the Independent Review of Children's Social Care interim review noted, the total cost of care proceedings to the state is close to £1 billion, or was close to £1 billion in 2009-10. Obviously, that is significantly more now, and the potential cost of a single public law case can be in the order of £80,000 on average. So not only very serious intervention in families' lives, but also a very expensive one. So as part of our report, we try to estimate the number of children who we think are affected by parental substance misuse. So looking at over the past 5 years worth of data, which looks at about 12,000 children in care proceedings. We estimate around 67,000 children are in families where their parents suffer from significant parental substance misuse. We think that equates to around about 40,000 care proceedings in the past 5 years. So it's a huge part of the care proceedings caseload. And as many of you on this call know, as a reaction to repeat removals and recurrent care proceedings, Fdac family drug and alcohol courts were proposed as a solution to that, to those problems. And we include it in the report a quote from District Judge Nicholas Crichton, who I'm sure many of you knew, who sadly passed away, but he was the first Fdac judge who said, what is it that family courts are here to do? Are we here to just take away children, or are we there to provide support to families to enable children to remain with their families? He was instrumental in setting up the first Fdac modelled on family treatment courts in the United States. And so the London Fdac pilot was established in 2008, funded via cross-government funding involving the Home Office and the Departments for Health and Education. So the first Fdac was established in 2008. As many of you will know, the Fdac model seeks to deliver better outcomes for children and families, including providing problem-solving interventions and support to tackle parental substance misuse, aim to keep families together where it's safe to do so, and where it isn't, to make sure that swifter care arrangements are made. Fdac also seeks to deliver better outcomes by making by controlling and ceasing parental substance misuse durably over time. Fdac also seeks to deliver better justice by delivering a more procedurally fair court process in which parents feel they're treated with respect, where they feel the court is acting as an independent arbiter over their case, where they understand what's going on with their case during the court process, and where they feel they can participate in a process in which they've got a voice. So what is Fdac? How does it differ from standard care proceedings? So Fdac differs in that it provides parents and families with a trial for change. What that means in practice is trained judges who motivate parents through a treatment plan while reminding them of their consequence and timescales. Judicial continuity, where parents see the same judge throughout the care proceedings. A multidisciplinary team which assists the judge, delivers interventions and assessments with parents and coordinates services. Non-lawyer reviews, so fortnightly review hearings with the judge without lawyers being present. Parents being subject to regular testing for drug and alcohol misuse, and where progress is being made, the possibility that proceedings can be extended. So that's what Fdac does. It's what we call a therapeutic problem-solving court that seeks to improve outcomes and deliver better justice. There's much more detail about this in the report, but just wanted to highlight some of the research that's been done into Fdac that suggests it delivers significantly better outcomes. So a 2011 study of the London Fdac pilot found promising evidence that it reduced parental substance misuse and increased stable family reunification by the end of proceedings. Follow-up study in 2014, which confirmed those results and also showed other results such as longer-term impact following proceedings and significant reductions in abuse and neglect. And then in 2016, a follow-up study that looked 5 years following the end of proceedings, which showed that the positive outcomes that Fdac delivers at the end of proceedings endure over time. For those interested in more detail on the research, please go to the Fdac national website at www.fdac.org.uk. In addition to that sort of quantitative evidence, there was also qualitative evidence about the impact of Fdac in families' lives. So that qualitative evidence showed that a high number of parents interviewed who'd gone through Fdac found that it had transformed their lives. We include a quote from a parent who said, "Fdac has been an enormous benefit to us. I've been freed from my addiction and my child has regained a father." Parents in particular signal out the judge's role in Fdac, saying that, for example, that no one had ever praised them before, and that role between the judge and the parent seems to be a significant motivating factor in the better outcomes. Also praise from parents for the Fdac team, the multidisciplinary team that works with the parents, encouraging them to be honest, encouraging a two-way dialogue that's based on mutual respect and honesty. And I think these quotes kind of speak for themselves. And some parents who are able to contrast their experience in Fdac with their previous experience of care proceedings. As the one parent said, I've been through an ordinary care case before. Normally you wouldn't get any advice. No one actually works with you. And that was contrasted with their encouraging and positive experience of Fdac. Research has also suggested that there's been successful replication of the Fdac approach. So researchers examined the fidelity to the model through court observations in 10 Fdacs in 2016. And they found that the Fdac approach was marked by a non-antagonistic support structure and mechanisms to motivate and support and remind parents of their responsibilities. That parents experience the services as intensive and holistic. Parental substance misuse is rarely the only problem in those families' lives, and the multidisciplinary team responds to that complexity. But also importantly, that the Fdac approach that was originally piloted in London had been replicated, and the early successes of Fdac hadn't been just down to one charismatic judge, and that Fdac more generally had strong judicial support across the 10 pilot sites that were going in 2016. And so what we've seen since 2008 is the growth of the Fdac model really across England. So since the creation of Fdac in 2008, there's been replication of the model, often with joint and local and national funding. Local authorities tend to provide the majority of the funding for Fdac teams, but the Department for Education has funded through its innovation programmes growth both in 2015 and again currently in 2019, a programme which is still ongoing to spread the Fdac model, with funding running up until next year. So we anticipate that by April 2022, there will be 16 Fdac teams across the country covering 37 local authorities, serving 25 family courts. The Welsh Government have also recently invested in building the first Fdac pilot in Wales, which will be open towards the end of this year. And so we now have a map of Fdacs increasing their coverage across the country, but as this map clearly shows, that coverage is absolutely not comprehensive. And part of the reason that growth hasn't been comprehensive is it's been held back in part by value for money doubts. So we know that, for example, there have been calls to roll out Fdac nationally. Public family law working groups interim report stated that Fdac should become the standard rather than the exception. The current president of the Family Division and indeed previous presidents of the Family Division have wanted to see Fdac in every postcode, but unfortunately that hasn't happened, and that's in part because of the cost of the Fdac team. So the specialist multidisciplinary team often involves a significant upfront investment, and that has at various points, because local authorities in particular are so squeezed on resources, has caused some doubt in some local authorities about whether it's value for money. So in 2016, as part of our work with the then existent Fdac National Unit, we did a review of Fdac sustainability, which identified that some commissioners were unsure whether the Fdac investment would represent value for money, especially whether it really generated cashable savings, with one commissioner more recently describing Fdac as an investment too far. So that's kind of brought us to the idea of looking at the value for money of Fdac. And obviously we're doing that very conscious of the fact that there's a spending review on the horizon. We want this value for money study that we've just completed, that we're releasing tomorrow, to be part of a public discussion about what that spending review should contain. We obviously think that what we try to set out here is what we think the value for money of Fdac is, but also what our rollout plan is. So I'm going to hand over to my colleague John Newman from Untitled, who's really helped us construct that value for money study. He'll go through the numbers, and then he'll hand back to me to talk a bit about what the report says in terms of our rollout plan. So over to you, John. I should say we're also doing a kind of double-hander thing here. So John will, I'm sure, tell me to move on next slides in a kind of Chris Whitty style. So apologies for that, but that's how it's going to happen.
Thank you, Phil, and thank you for asking me to speak to this today, and welcome to everyone to the session. So my name is John Newman. As Phil said, I'm a director of Aptalogen, and we've been working with the centre for the last few months to carry out this value for money study, or cost benefit analysis, you might also call it, as part of the business case, and which will be set out in more detail in the report tomorrow. Before I take you through the results of that, I'm not going to go through all of the different, all the bits of detail that's in the report, but I'm going to present to you sort of the headline findings. But before I do that, just a couple of things to say. What we tried to do with this piece of analysis was to quantify, using existing evidence and existing data wherever possible, quantify the average cost per case of a case going through Fdac compared to standard care proceedings. So it's a little bit different to what had been done before in some ways. And our focus was on those costs that can be attributed to local authorities and to the Ministry of Justice through its various agencies that are involved in care proceedings, either through Fdac or through the standard route. The reason we excluded a whole range of other things is largely because there isn't much data available, or it's very difficult like-for-like comparison. So there might be data available for a case going through Fdac, but we wouldn't know necessarily what that would look like in standard care proceedings. So we focused on those things where we think there is a good estimate available of a like-for-like comparison between a case going through an Fdac process versus standard care proceedings. And then the other thing to say is this wasn't a new piece of data collection. So we didn't work with Fdac teams and local authorities for them, to look at collecting new data. We used data that already existed from a whole range of different sources. And then we tested and validated that with, through discussions with a range of people working in the field and experts who have knowledge about Fdac cases, Fdac care proceedings, and standard care proceedings as well. So, Phil, if you want to go on to the next slide, please. So this shows the areas that we've included in the analysis. And you can see that there's two main stages. So we've included costs that relate to the care proceedings themselves. So it's typically a sort of 26-week court process, although Fdac cases where there is promise for positive outcomes will go on for longer than that. But we've sort of grouped care proceedings as sort of in year, so year one costs. And they relate to primarily the cost of the Fdac team for an Fdac case, and then a whole range of other things: local authority legal costs, costs of parental legal representation, expert assessments, drug testing, placement costs during proceedings, and the costs of children's guardians and court time as well. Then the second main area that we've included in the model is post-proceedings costs, and we've included care costs to local authorities for the first 2 years following proceedings, and in some cases those costs will exist for much longer than that, but we've limited it to 2 years, and the likelihood of cases coming back to court again in the future. And that is for a period of 5 years, up to 5 years typically. As I said before, we've excluded a number of other things, largely because there's very little data of any sort of use for this type of analysis. And they're things like longer term outcomes, such as educational attainment, etc., cost to the criminal justice system of substance misuse related crime, and obviously costs to the NHS and the health system in relation to subsequent treatment. But even the best case scenario in this doesn't include things for which there is evidence that there would be positive outcomes and potentially some positive cost benefit from Fdac in the future. And moving on then, please, Phil. So we've focused our unit of study, if you like, as I said at the beginning, on the average cost per case, and then we've worked that up to a typical team size of around 30 cases. And that would be where an Fdac team might cover 3 local authorities, here 30 cases per year, and we know that on average that would mean that there is 1.7, so nearly 2 children per case. Next slide, please. Before I present the results, the final thing to say is that what we've done is we've worked out 3 scenarios. I'm only going to present the results from the sort of the midpoint, because we think that that represents our best judgment of the likely costs and benefits of Fdac versus standard care proceedings. But what we did in order to arrive at that was develop what we've called a worst case and a best case scenario. And they vary primarily on the assumptions in those different scenarios around legal and expert assessment costs, around the outcomes that are generated from Fdac, and therefore the types of care costs that would be incurred by the local authority post proceedings, and also in relation to the likelihood of recurrent care proceedings. So as I said at the beginning, we used a whole range of data sources and evidence sources to come up with this, and where those differed quite significantly from one end of the spectrum to another, we use those to formulate our worst and best case scenarios, and then to generate the sort of the central projection, which I'll present the results for now. Next slide, please. So the results, looking at a team covering 30 cases per annum, we estimate that each Fdac would save and would generate net savings. So this is after including the cost of the Fdac multidisciplinary team, that each Fdac would save around £800,000 per annum, just under £800,000 per annum, which is equivalent to around £26,641 per case. Now, of that £217,000, nearly £272,000 of that is saved in year. So in the year of the proceedings taking place, and then around £527,000 of that is saved within a 5-year period post proceedings. And that covers both the in-proceedings costs, and as I said earlier, the care costs for 2 years post-proceedings, and the likelihood of cases coming back to court for recurrent care proceedings within 5 years. Next slide, please. So if we break that down slightly, we've used an estimate in here that the Fdac team covering 30 cases would cost the local authority £540,000. And the analysis shows from a value for money perspective that the cost of the Fdac team is more than recovered by local authorities and the legal aid agency, if we include parental legal representation, more than covered by the cashable savings that are generated purely in proceedings. And even if we don't include the parental legal representation, which is a cost to the legal aid agency, the £540,000 is still recovered by local authorities in year, with those additional costs that I mentioned just a moment ago that would be recovered over the coming 4 to 5 years. Next slide, please. So we've shown here a breakdown of the differences between agencies. So as I said earlier on, we've included local authority costs, and we've included Ministry of Justice costs, which are legal aid, children's guardians, and sort of general costs for court time. Bill mentioned, one of the big evidence outcomes or benefits of Fdac is that it reduces the amount of time in court, and it reduces and avoids lengthy and contested legal hearings. The majority of savings are realised by the local authority, both in year and post proceedings. It totals about 615,000. And then there are also significant savings for justice agencies, including the legal aid agency of 184,000. If we plot that over a time period, unfortunately, there's not a lot of evidence that breaks it down year by year, but if we make some broad assumptions about how that would be distributed over a period, we can see that that represents that around a third of the savings are realised in year. And then by about year 3, it's over 80%, it's about 85% realised within 3 years following the end of proceedings. There's quite a strong, this is all based on our central projection and based on a caseload of 30 cases. There's quite a strong argument in terms of the value for money side for Fdac if we use the evidence and the data that exists. So in conclusion and in summary, Fdac represents value for money for local authorities. The investment of £540,000 on average for an Fdac team to hear 30 cases across 3 local authorities. We've estimated savings in the region of £800,000, 615,000 of which goes to the local authority. Our analysis also suggests that Fdac saves money primarily on legal costs in year. If we take just the legal the in-year in proceedings costs, which amounts to around 608,000 for local authority legal costs. The evidence supporting these figures is because Fdac has been shown to be a fairer way of hearing cases. There's qualitative evidence to support that, which Phil presented earlier and for which there is more detail in the report. Fdac is a more procedurally fair way of hearing cases, and this has a financial payoff by avoiding expensive legal costs, and particularly in terms of contested hearings. And in addition to that, Fdac avoids significant costs post-proceedings, both in terms of the outcomes for where children are placed and the reunification rates to return to living with families, but also in the likelihood of recurrent care proceedings, both for those children and for other children that those parents may go on to have beyond this particular case. I'll stop there, and I'll hand back to Phil to talk about how this and how these figures then reflect in the national rollout projection that we've put together for the report.
Okay, thank you, John. Yes, so based on that value for money analysis, we've then subsequently constructed a model for what the rollout of the Fdac model would look like over the next 3 financial years, that is the years from 2022 to 23 and onwards. So what does that mean in practice? So we've modelled the rollout of Fdac to every local authority in England and Wales by the end of 2024-25. So that's been our the main thrust of this, is to have an Fdac in it serving every local authority. It doesn't mean one Fdac team in every local authority, but Fdac services being available to every local authority in England and Wales by the end of 2024-25. So our modelling is based on the creation, therefore, of 38 new Fdac teams. So that's 38 teams plus the existing 14 teams by the end of 2024-25. So 52 Fdac teams providing Fdac services across the country, serving every local authority based around the 44 family court care centres. So just to clarify what that means, so family court care centres are presided over by a designated family judge who oversees all family court business in a specific area. The reason that we think that we'll need 52 Fdac teams to cover 44 family court care centres is we predict and estimate that certain care centres, particularly ones in urban centres such as Greater Manchester, may require more than one Fdac team. We're also conscious of the fact that there are challenges about the provision of Fdac in large rural communities where geographic distance between teams and service users can present challenges, but we've tried to account for all of those things. So what we've modelled in our report that's out tomorrow is the idea of Fdacs available to every local authority by the end of 2024-25. So our assumptions around that are as follows. So obviously the need to fund all of those 52 Fdac teams across England and Wales phased over 3 years, as I said, those 3 years being 2022, 23 onwards to 24, 25. We've assumed an increase in each Fdac team's caseload capacity. So at the moment, the current average of cases per team is 27 cases per team a year. We think that will increase, or at least our modelling assumes that increases to 31 cases, so a relatively modest increase of cases per team. We've also applied certain modest economies of scale to that caseload. We've also assumed a 50-50 split in terms of carrying the costs between national government and local authorities. That's partly based on conversations and our operational experience that suggests in order to make Fdac sustainable, local authorities need upfront subsidy to create the Fdac teams, but they also need to buy into it and have, to use a phrase used by a commissioner, skin in the game to keep them going. In the past, Fdac has grown when local government and national government have shared the cost in our view, and based on the modelling that we've done, this remains, we think, the best route to sustainability. So those are our kind of assumptions. We've also included within our overall costs a certain number of national fixed costs, which will attach to further evaluation of the Fdac model and also the implementation support to Fdacs. So in terms of setup and training and the sorts of services that we've been providing to Fdacs during the current DfE innovation funding. So that's our kind of assumption of our cost model. So what our report and what our analysis suggests is, as you'd expect, as the number of teams rise, so the number of teams is represented here in the bar chart. As the number of teams rise, so will the costs. So these are year-by-year costs. So as more Fdacs come online, obviously the costs increase. We estimate the cumulative cost of 3 years worth of growth would be 65,000 over 3 years. We've also then, based on the work that John just presented in terms of what we think the likely savings are, we expect there to be cumulative savings over that 3-year period of £91 million. That's net savings, so that already takes into account the costs that would go into that expansion. So these are net savings, and the £91 million is cumulative over the 3-year period, and that's based on all the sorts of savings that John has just walked you all through. What will that mean in terms of the caseload? So we estimate that over that 3-year period there'll be in total 3,500 Fdac cases. So what we'd see as in terms of a yearly caseload is, so at the moment our baseline is around about 375 cases going through Fdac each year. That would rise by 2024-25 to over 1,500. So a big increase in the number of care proceedings that Fdacs would cover. In terms of what we think that means in terms of the percentage of total parental substance misuse cases that go through the system, we think that at the moment, we think Fdac covers only about 5% of those cases. So under our rollout plan, that would increase to 21% of all parental substance misuse cases. So there'd still be a way to go if we wanted Fdac to cover all parental substance misuse cases, but a significant increase in the number of cases that would come through FDAC. In terms of what that means in terms of the number of children who may benefit, again, we think at the moment we estimate around about 650 children benefit from FDAC each year, or go through care proceedings that go through FDAC each year. That would rise by 2024-25 to over 2,500, a total of 6,000 children in the 3-year period that we're talking about going through FDAC. We've also tried to model what we think that will mean in terms of outcomes. So during rollout, we anticipate that over 1,300 families that go through FDAC will be reunited or continue to live together. That's, we anticipate around about 400 more families being reunited by going through FDAC than would have been if they all went through standard care proceedings. We expect that over 1,600 mothers will stop using drugs and alcohol as a result of our rollout plan. That's an additional 600, or nearly 600 additional mothers stopping using drugs and alcohol by the end of proceedings. And we also anticipate that that will net into a sustained substance misuse cessation by those mothers of around 700 additional mothers. Sustaining their substance misuse cessation during that 3-year period. The reason we talk about mothers is because the evaluations done to date have mostly been able to track mothers, but have been less able to track fathers through proceedings. So we've only been able to present the impact of this on mothers. So that's what we think the rollout could look like. That's what we think the rollout could look like. That's what we think the impact of the rollout could be. As I said at the start, care proceedings are obviously one of the most serious and expensive interventions the state can take in a family's life. For those of you who've read it, the interim report of the Independent Care Review specifically identified FDAC as exemplifying the sort of future care system which builds, not breaks families, to use that quote from the Independent Care Review. We think the evidence clearly suggests that FDAC is a both more effective way of hearing care proceedings, but also a fairer way of hearing care proceeding cases which involve parental substance misuse. We think the qualitative and the quantitative evidence points strongly in that direction. And obviously now our value for money analysis strongly suggests now that FDAC is all those things, but also significantly less expensive way of hearing care proceedings than the standard approach, because it avoids lengthy legal disputes and it generates better outcomes after proceedings end, and therefore FDAC delivers both cashable savings and wider avoided costs. So our report argues very strongly for the government to secure investment within the forthcoming spending review to roll the FDAC model out as per our plan in phases across all local authorities in England and Wales. And I should say, we say England and Wales, obviously that would be subject to Welsh Government endorsement by the end of 2024-25. Our projection estimates that the national rollout would require the establishment of 52 FDAC teams serving the 44 family court care centres across England and Wales. We believe the cost of that to national government will be £34 million over 3 years based on 50-50 match funding with local authorities. We think that will generate savings of around about net savings, I should say, of around £91 million. And as John said, we think there are other wider savings to other public bodies that we haven't been able to quantify. So in closing, with the spending review coming up, we think it's time to make sure that FDAC is available to every family in England and Wales who needs it. The financial and social and human costs of continuing with business as usual, with children unnecessarily being separated from their parents and going into care, are, we would argue, far too high. And now with this rollout plan, we think there is a clear alternative to that on the table. That's what our report will say. As I've said many times, that report is out on our website as of 9 AM tomorrow morning. We will be releasing, obviously, that to the press and really trying to make the argument that this is the right way to go. So that is our report. And now we sort of move into the question and answer session. So as I said before, that Q&A will be with me and with John and my colleague Vicky to take your questions. So how this will work, if you could raise your hand and then I'll call on you to turn on your camera and and unmute yourself and ask your question. And also it'd be useful for us on the panel to know who you are, where you come from, what role you have, if any, around Fdac, or whether you're an interested observer. So that would be really useful. So if people can use the hand raising function, it would be great to see. So I've got a hand raised from District Judge Judith Crisp. So you're first up.
You see me? Yes.
Yes.
Excellent. Hi, Vicky. I've just recently started Fdac in Stockport in Manchester.
Mm-hmm.
I had a meeting with the Stockport team this week, I think, and they are currently scoping the ability to roll out across Manchester, given the success, I have to say, that we've already seen in Stockport. What I was wondering is if they are successful in getting the money back for the scope, which I think is going to be this week or possibly next week, can they access any money from other sources if they wanted to roll it out?
I'm really happy to kind of take that question. Hi, Judge Crisp,
Hi,
and great to hear that it's going so well in Stockport still as well. Basically, the answer would be this is our kind of plan, this is our vision. So it's absolutely not anything that's like set in stone in terms of whether this comes into fruition from the spending review. But we would envisage, and again, really aware that Stockport are kind of looking at and have put in for some money from the DFE around looking at scaling the Fdac across other areas in Greater Manchester, and what we're proposing and kind of calling upon government to look at, we wouldn't see as interfering with that at all, and we would kind of definitely be advocating that if anything were to be able to happen around the spending review and that wouldn't exclude existing Fdacs, that, you know, it would be very much about trying to spread that. So we would see it as complementary to that work that they're already planning on there as well. Okay, thank you.
Yeah, and I think I would just jump in there and just to underline the point. This is obviously the Centre for Justice Innovation putting forward our view on what the future should look like. There's absolutely no commitment by government to do anything other than occasionally listen to us. But that doesn't mean that they would necessarily agree with us. But this is what our plan is. I mean, I think one of the things that's worth also pointing out is if local authorities or other local commissioners, if this plan were to happen, and local authorities and local commissioners wanted to, as it were, add more money into the pot, what we've described to you today is, you know, spreading the model geographically, but not actually reaching every case that's there in the system. So if there was more capacity, there are definitely more, as it were, more cases out there. So that's kind of worth bearing in mind if this were to ever happen. But obviously, who knows what political futures hold. I mean, today of all days, we don't know what political futures hold. So we'll see. If I move on, I think the next hand up I saw was from Peter Green. So yes, if you would ask your question.
Yes, thank you, Phil. I'm the chair of the National Network of Designated Healthcare Professionals. If I may say so, first and foremost, I think Nick Crichton will be immensely proud of today, and this sort of discussion is very expansive view, because I think this is a wonderful presentation that you're making, and a strong case for the development of the Fdac in the way that you're suggesting. Coming at this from the perspective of a health professional, I was intrigued by the very circumscribed framework in which your financial projections were made, because I see any sorts of savings around drug and alcohol misuse as representing huge benefits for the health system, not just from direct clinic saving costs, but the ongoing health benefits for contained drug and alcohol misuse, and the psychological therapies, which are always expensive. So I'm intrigued by the fact that, well, I suppose the question I want to ask you is, are there any plans to try and make a bigger case about the savings in the health service? Because this feels more like a public health initiative than it does a judicial one, and it's one to be welcomed. And as somebody who's got an overarching interest in health and well-being of all children who are clearly associated with these sorts of legal wrangles and processes, we're really interested in making sure we can support them as fully and as loudly as we can, and indeed adding something to them if that would be appropriate. Because the idea of an Fdac plus, which may take the family so far on the road, but there may be more healthcare stuff which we could be supporting and developing as a thesis, following that in very much, well, it's an intervention, it's not, it's a support network, but building on that.
Well, I think, I mean, and I'll hand over to John if he's got any comments on the why we've limited ourselves to primarily local authority and justice costs. But I know that in our 2016, I think it was 2016 value for money cost avoidance study, we did note that there were savings to the health system in avoided treatment and testing costs. The reasons why, well, I think I'll let John sort of discuss the reasons why we didn't include that in this analysis, but I think what the report hopefully shows is that we are more than aware that there are other savings to be made here, and indeed, you know, just reflecting on the original pilot back in London in 2008, you know, Department of Health put money into that, and I certainly know that there are Fdacs now who have bits and bobs of public health money, so it's definitely not just for local authorities and justice, but we obviously constrained our analysis to that. But I don't know if John wanted to comment on that.
The only additional point I'd make, I mean, I very much support, Peter, what you're saying in terms of the healthcare aspects of Fdac. I think it is a public health intervention, if you put it that way, as much as it is an intervention from a justice point of view. I think the issue for the purpose of this current analysis was that from the data that already exists, we had no realistic way of comparing the costs to the health system in an Fdac case versus a standard care proceeding, notwithstanding that there is evidence that there are costs to be avoided, but we didn't feel that there was enough in the existing analysis to come up with a sort of a comparable like-for-like comparison. So I would very much support the idea that further study, further analysis, further data collection would be of huge benefit to add to this business case. But unfortunately, in the time we had and in the data that we had available to us, we had to sort of put that to one side, but we didn't want to undermine its significance in the whole equation. But in terms of putting the numbers forward, we weren't able to include that.
Yeah, I'd rather suspect that was the case, but thank you for confirming it.
I just wanted to add as well that I think criminal justice agencies are another sort of really area, again, that's similarly to health, that we weren't able to sort of quantify or to say anything that wasn't so sort of abstract and longer term around that. But I think that's certainly another area in terms of where there are kind of savings being made. You know, we know that there's a reduction in police call outs and, you know, many other kind of various things around criminal justice. So that's certainly an area that I think is similar to health, in that there's definitely a place for adding to this business case and trying to quantify some of that too.
Thank you for your question, Peter. So the next hand I saw was from Geraldine O'Hare. So Geraldine, do you want to ask your question and declare your interest?
Yes, hi everybody, good afternoon. It's more of a comment. So I'm from the Probation Board in Northern Ireland, and I just want to say well done. You're so leading the charge in this, and I think the work is fantastic. I think everywhere needs Fdacs, I really do, and I would love them to come to Northern Ireland, and I suppose that's my question. I don't know if I have any colleagues on from Northern Ireland because I can't see, but if I do, it would be great to have another opinion. I think Peter Green in his last comment made a really good point about it's a public health matter, which health and justice need to support together. As you know, Phil, we did have an Fdac here in Northern Ireland. We don't anymore. I really think we need to do that. It is proper getting upstream. It is proper problem solving at that very early stage, because we get them therefore down the line in terms of adults if they're not, if we don't address this upstream. So I suppose my question to you is, how do we try and work to get other government departments to work closer with criminal justice and indeed with health to make these work and to get them upstream in the first place? It's so important. I don't want it not happening here in Northern Ireland, because it should be the first of any problem solving initiative.
Well, I agree with all of that, Geraldine, and I wish I could tell you how. I wish I could sort of wave a magic wand and make this happen in Northern Ireland. I mean, I guess part of what we're trying to do with this business case, and more particularly with the value for money study, is to demonstrate the kind of pound, shilling and pence argument around Fdac. It's clearly the right thing to do for so many sort of moral, ethical and technical reasons, but also what we're trying to show, and I think we've been able to do that, is that it also saves you a bunch of money. Now, one of the things that we are doing as a follow-up to this work, which we hope to have available to people relatively soon, is a kind of what we're calling a kind of local value for money tool, which allows you essentially to plug in your own numbers, whether they be unit costs or etc., to generate your own value for money estimates. Now, whether those numbers would apply in the Northern Irish context, I don't know, but we certainly, in some ways, with our partners at Intelligent, we've worked out the methods. So if we could, as it were, get your numbers and stick them into our Excel spreadsheet, I'm sure we could help you out. So I certainly think it's part of the argument, but I also think part of the argument is, as you've just articulated, it's the right thing to do because it's intervening with parents early. We don't know, for example, what the real impact of Fdac is on, for example, the criminal justice system, but I think it's a reasonable assumption to think there are avoided prison places somewhere. How far in the distance they are, I'm not sure, but I actually think that's definitely part of it. But as you know, we are always happy to come to Belfast to help you do.
Well, I'll be lobbying for you to do that, and this provides the perfect platform for my evidence. So thank you very much for that, and well done.
Thanks, Geraldine. So in terms of the next hand up that I saw, so I've got a hand up from Terry Galloway.
Hello, hello Vicky. I got really excited, and then Peter Green mentioned about the savings from the other departments. Yeah, my name is Terry Galloway. So I kind of been through the system myself. I've also been through as a litigant in person through care proceedings, so I've kind of get all that side of it as well. In terms of Fdac, I'd kind of like to see, like for my sister, for instance, when she was going through care proceedings, she really didn't trust the local authority. And I'd really like to see for those kids that are care experienced themselves to have access to these Fdac teams before they even get into care proceedings. And I think that really needs to be kind of thought of carefully in the expansion plans. And in terms of responsibility, for me, as a child coming out of care, you know, I could have been angry like my sister, and I could have blamed everything on the local authority and said it's all their fault. But ultimately, it's society as a whole. You know, as a whole society, we need to kind of take responsibility, because like these are our children and our families. So in terms of showing what these different departments the financial saving, that makes the business case. Quite often these departments don't actually know how they can contribute towards the solutions. And within the FDAC model, if you like kind of deep dive into it, that it is a network, it is a scaffolding of all the services that are local, which are national, such as the NHS and the criminal justice system. So, you know, I really think it's a good idea, and kind of, I just wanted to say that.
Thanks, Terry. And I think you've kind of really hit the nail on the head around, I guess, the blueprint that we've kind of got here is quite small scale. And what we hope is, I suppose, realistic in this spending review in terms of let's get an FDAC everywhere. And here's, you know, on average 30 odd cases. But we know, for example, that there are more substance misuse cases than that, you know, if we were being completely ambitious, we would want all kind of, you know, all substance misuse care proceeding cases that were eligible to be able to go through FDAC. There's also potentials around testing this approach with other types of care proceedings cases, but that don't feature substance misuse. So where domestic abuse is the kind of predominant concern, mental health issues, or, you know, I think that there is other scope for looking at it. And then certainly around what you were talking about in that sort of, I guess, early FDAC, so pre-getting to that, pre-proceedings, pre-getting to the care proceeding stage. And we think that there's that real potential for the model to do more than it does. Some areas that have FDAC do kind of work in the proceedings space. I should say that although FDAC is modelled around parental substance misuse, you know, domestic abuse, mental health, neglect, those sorts of issues feature in the majority of cases as well. So I think that I sort of share your ambition, Terry, as well about you know, let's see what else we can do with this too. I think this blueprint is what we've tried to present is something that doesn't feel too huge and abstract. This is something that the government could realistically achieve within those sorts of timescales, but really up for looking at other bits too.
Yeah, absolutely. So I've got one more question, I think, from Matt Heath, and then I'll sort of wrap things up because I don't want to stand between you and I'm sure dinners and children bath times and all that kind of stuff. So Mac, and then I'll wind up.
Thank you, Phil. I'll try to be quickly. Matt Heath, Director of Children's Services for Milton Keynes, but host of the Milton Keynes and Bucks FDAC. I think largely in the sense of today, I think we probably all commend what's the work that's gone on here. And I think probably there's a risk of us being preaching to the choir a little bit, isn't there? A sense we're probably all on this call in agreement with FDAC and what we attempt to do. I would just want to echo some of the comments earlier, really. I think Peter Green brought this up, and I would too, in regard to the sense of responsibility from all the other agencies, as well as not just local authority, judiciary, but also such things as health, public health, police as well, and all of those that we do know have financial benefit from this work that we're wanting to move forward. I suppose what I would reference is about the fact that there are lots of evidence of things such as this model move forward and being successful at getting other agencies to also put their hands in their pocket. I think, for instance, some of the DfE innovation funding, like family safeguarding models, etc., whereby the public purse across the piece has been successfully drawn upon. But I would also suggest that we need to think together about how we use the right narratives to perhaps convert the yet unconverted on this issue. And I think that's including using the right narratives in different forums. So there are within local authorities and local partnerships, be it safer community partnerships, be it safeguarding networks, be it health and wellbeing boards with the rolling out that consistently goes on in regard to health colleagues. We need to find ways to make the debate, I would suggest, in those places as well. And just my last point, if I may, the challenge I think that I hear from different local authorities, and not just local authorities, of course, but the nature of and the discussion of cost avoidance in the current savings landscape has perhaps smaller capital than it used to have, because it's so much about savings now than what the future will bring in cost avoidance because of the challenges that are being faced. Now, that's a point that I know others will know, but I think it's so critical when many of us are trying to get our politicians on board behind investing within local authorities, such schemes as this, and the difference it makes for children and families is so critical. So, but thanks very much for the work on this, much appreciated. Thank you.
Thanks, Mac. And yeah, I think just to pick up on a couple of things and then I'll wrap up. I mean, I think your assistance and other people on the call to get those narratives right for the right audiences has been really crucial, and we will continue to lean on a number of you on this call to get those narratives right. I think in terms of your final points around avoided costs, one of the reasons that we've kind of tried to concentrate on the areas we have is to try to really focus down and be clear about where we think there are cashable savings, where things are avoided costs, and we haven't tried to stray into the social return on investment language. We've tried to mostly talk about avoided costs and cashable savings in quite a conservative way. I'm aware that we're 1 minute over already, so I really don't want to separate you from, I'm sure, busy lives outside. So just for me to say thank you to all of you for attending this seminar. As I said, the report will be out at 9 AM tomorrow morning. It will be going out via our newsletter. If you're not signed up to our newsletter, please go to our website and sign up to our newsletter. I'm sure we'll be tweeting about it for those of you who are Twitterers. And we'll also be sending it out to everyone who's on this call. I will send a copy of the report as well. Please forward it on to your friends, family, and significant other influencers. As I said, this is a piece of we think this represents, as Vicky said, a realistic and a reasonable plan for taking Fdac forward and rolling out across the country. As we said, there's a spending review coming up. Please write to your local MPs, all that kind of stuff, and just apply pressure, because we think this is a unique opportunity to get Fdac spread across the country. So just finally from me, thank you very much. Thank you particularly to Lucy and Duncan and my team for organising this webinar and managing people's tech competence, including my own. So yeah, I hope you all have a very nice rest of the day, and I'm sure we'll see a number of you in the next few days. Cheers, thank you.